We spent maybe another 4 to 5 sessions with the parents, just trying to figure out ways that they could support them. But the parents, they just were not open to it. Finally, I got to a point when I sat down with the parents without the kid and I said, I understand that this is not something that you agree with, something that you would accept, but I do want you to be open to it. It's better to have a gay child than a dead child.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top practitioners in health and beauty, both inside and out. I have Zena Chase, a dual licensed mental health counselor and clinical addiction specialist with certifications in trauma, sex therapy, grief, CBT, MI, addiction, EMDR, brain spotting, and eating disorders, to name a few. She's experienced in inpatient and residential treatment, PHP, IOP, individual, couples, and family counseling. She's an author of 4 books, a memoir, poetry book, and 2 children's books. She owns a private practice and is a director of a group practice, a mentor, and taught master's level clinicians. She's also done work in recidivism and reentry. So Zena, welcome and glad to have you here.
Oh, thank you. Thank you for having me. Happy to be here with you.
Yeah, so let's start from the very beginning, Zena. How did you first get interested in, let's start with like the broad sense, the medical field.
Well, I've always been interested in the medical field, actually. Ever since I was very young, I wanted to be a nurse, and I went to in undergrad, I was a double major, nursing and psychology major. So I've always wanted to be a nurse, wanted to be in the medical field, wanted to help people.
Mm-hmm. Okay. And so what led you to transition over to the mental health side of things?
Yeah, so while in undergrad, actually, my junior year, I was diagnosed with lupus. For people who don't know what lupus is, it's an autoimmune disorder that basically your body just attacks itself. It took them a very long time to diagnose it, over a year. So when they finally were able to diagnose it, I ended up in a hospital for about 4.5 months. It took me about a year to recover. So obviously, once I got to the place where I was recovered enough to go back to school, I was basically kicked out of the nursing program because I had missed more than 2 semesters. Pretty much lost everything that I had at the time, which caused me to go to therapy because obviously I got very depressed from the whole thing. While in therapy, I got a different perspective of what it was to actually help people in a different way. My therapist was amazing. Still I credit her today with the passion that I have behind mental health. So she really pulled me out of a very dark place. And once I got into therapy and realized how phenomenal it was in terms of just change, it pushed me back into the field. So instead of being a psych nurse, I ended up going into counseling and became a counselor.
Got it. Okay. And so that led you to having your own private practice. So what led you to decide to start your own private practice?
Well, going into counseling, from the undergrad level into the graduate level, I knew that I wanted to have my own practice so I could do counseling in the way that I wanted to do it. While obtaining your counselor degree, you go through internships, you have practicums, places that you work with other people, and you get to see a little bit of how different practices are run. Everybody has their own niche. Everybody practice runs a little bit differently. And there's so many different sectors in mental health and substance use that I knew that I wanted to make my practice a reflection of what I see when I look into the world. That was important to me. So chasing the vision is about meeting a client where they are and helping them get to the vision that they see themselves in at their best selves.
Okay, so Zena, so now you have the practice. I want to go over some of the most common situations that your patients come to you for. I mean, in introduction, I know there's a lot of different things that you cover, but what would you say some of the most common situations that your patients come to you for?
The most common thing I see is anxiety. Anxiety and depression. I think that where we are in the world right now, with so many different things going on, I think a lot of people are affected by the things that they're seeing on social media, the things they're seeing in the news, the things that are happening around them, career fields, job placement, things like that. I have a lot of people with just generalized anxiety.
Mm.
And everybody has anxiety. Anxiety is healthy. I tell people all the time anxiety is not a negative thing, it's healthy. You're supposed to have some level of anxiety when doing things differently, meeting someone new, going to new places. Any type of change should induce some sort of healthy anxiety. Anxiety becomes a problem when it starts to interfere with the way that you show up in your day to day life. So if it starts affecting the way that you show up in your relationships as a family member, as a friend, as a coworker, it starts affecting your work, it starts affecting your time management skills, just the way that you get through the day, then it's usually a problem.
Okay.
Um, yeah.
And when it comes to I guess, trauma versus addiction, as you said, people come to you for anxiety, but also people come to you for trauma, also addiction.
Mhm.
What's the difference between those two?
Trauma and addiction. Well, the
Mhm.
funny thing about trauma is most people actually don't know that they have trauma.
Hmm.
A lot of times when we as therapists and clinicians in our individual, like our initial sessions, we ask about, hey, tell me a little bit about any trauma you might have experienced. And most people will say, I don't think I've experienced any trauma. I had a great childhood. And you say, well, tell me a little bit more about that. How was your childhood? I don't remember. Usually that's the first indicator of some sort of trauma has happened and your brain has just compartmentalized it so well that you don't remember. So trauma can be anything from moving around a lot as a kid, being a military kid. It can be experiencing poverty. It can be any type of abuse or witnessing any type of abuse. It can be not having enough food, or it could be religious trauma. If you were raised in any type of religious sector and your family pushes, religion on you growing up, it could be religious trauma. There are so many different types of trauma. I know most people think about like sexual abuse when you say trauma, like, oh no, I've never been sexually abused, but they may say I lost both parents at a young age, or I ended up in foster care. I was really close with my grandmother, and she disappeared from our lives after an argument with my parents. So all those things are trauma. And with trauma sometimes comes addiction. So addiction is very rare that a person with addiction also doesn't have trauma. So addiction can look like many things. There are some people who genuinely just enjoy using substances and the effect that substances give them. And then there are people who have different types of mental illnesses who utilize substances to cover up or to numb those mental health issues. So schizophrenia is a common one. Schizophrenia, any type of the schizoaffective disorders, sometimes they cause hallucinations, they cause visual, auditory, tactile hallucinations. They cause you to be in just different states of mind. And most times, other people can't understand what you're going through. So they may become more distant. And a way to just kind of shut the noise off is to utilize any substances. That could be alcohol, it can be, cocaine, heroin, methamphetamines, pain pills, any type of opiates, to just numb the pain and quiet their brain. A lot of people with trauma as well, people who have been sexually assaulted, is a very high one in terms of substance use. Typically, will utilize substances to just not think about it, not feel the pain that comes after it. A lot of people grow up in households that aren't ideal or aren't things that you see on television, right? And a way to numb that pain and to get rid of it is just to just utilize substances. You see that a lot in teenage households. I know now with the newer generations that we are seeing, substance use has gone down significantly. And I think that's because they have more freedom to be themselves. Whereas you think of older generations, it's you pretty much following what your parents have in line for you. You don't really have a say so. It's, do as you're told and move on. Whereas now, I think the newer generations, we're giving them more of an outlet to be themselves, to express themselves. Of course, it's cultural. We do have some cultural differences with that, but I think that it's it's minimizing the need to utilize substances. Whereas when you don't have a voice, if that
Mm.
makes sense.
Yeah. Okay.
Um,
That's
yeah.
interesting. Interesting way of looking at it then. So when it comes to, because you mentioned earlier that with trauma, not everyone knows that they have any type of trauma. So I
Mhm.
guess what's the reason that they decide to come in and talk to you if they don't know what trauma? Do they just kind of know that something's going on? Like, I guess how does that manifest? Or like, okay, something's going on, but I don't know why.
Yeah. So with trauma specifically, it can re-trigger itself at any time. Say, for example, you grew up in an abusive household, and your parents, let's say your mom and dad split because of abuse when you were in kindergarten, but you witnessed them fighting a lot. You may go all the way through life into mid adulthood, young adulthood, let's say 25 years old, and you're sitting in a Starbucks and a fight breaks out, and then all of a sudden you feel this intense amount of fear, you feel anxiety, you feel just a heightened sense of emotions that you aren't sure what it came from. And so that's how trauma works. Trauma can reappear at any given time with any trigger that you may or may not understand. And then you go to therapy and say, I'm just not functioning right. I was in Starbucks, I wasn't involved in a fight, but I don't know. Ever since I witnessed that fight, I've been unable to keep up with my work at work. I've been unable to focus. I haven't really been eating or sleeping well. I'm not really sure what went on. And a lot of times we'll utilize tools such as EMDR, excuse me, or brain spotting. And EMDR and brain spotting is a way to just tap into some of those compartmentalized memories and bring them out. So a lot of times with trauma work, you'll start to bring things out that you had no recollection of prior to doing the trauma work. So you may start to remember, oh, I remember, my dad and mom used to fight a lot. And I used to hide in my room, or I would try and break them up. I didn't remember that until now. So trauma is weird like that. It can pop up at any time. You
Mm.
may feel like, oh, I lost a lot of people at one time and I feel okay. Feel a little down, but I think I'm okay. And then years later, you may be crying uncontrollably or just random crying spells out of nowhere and start to feel depressed and aren't quite sure why.
Mm. Okay. And when it comes to the treatment, I guess what can people expect when it comes to treatment? Because I think people kind of, if they've never gone through therapy before, they kind of think about, oh, they lay on a couch and they kind of talk, the doctor kind of asks them these questions. They just kind of sit there and ask the questions. Like, is it something like that? Or like how does the treatment typically go? Like, what can people expect?
Yeah, I want to say first that all counselors have their own style, right? So it's not a one size fits all. You may go through three counselors before you find the one that you can connect with. I always say read their profiles, look at their pictures. If they have videos, watch the videos, take a session, take a few sessions to see if you really mesh well with them. If it's not a person that you feel comfortable with, you don't have to feel like the person's like your best friend, but you want to feel a certain level of comfort, like, this looks like a person I can talk to before you embark on this counseling journey. Because if it's not a person that you feel comfortable with, chances are you're not going to open up to them. You're not going to make much progress. So, in a counseling session, I know with me, you have the people who may come in and actually lay on the couch. I do have clients who come in and they stretch out across my couch, they take their shoes off, they get really comfortable. And I have people who might come in and just sit in the lazy boy chair and put their feet up and just lay back and kind of relax. I have people who may just come in and, sit on the edge of their seat. So it looks different for everybody. I always say do what makes you comfortable. Of course, I have lots of pillows and blankets and fidgets and, just things that can give you different sensations in a room if you need them for either comfort or distractibility. Sometimes some people need to be distracted to really go into detail about personal things, which is completely okay. So I always say, do what makes you comfortable. You're the person that's comfortable. I know me personally, I hate wearing shoes. Most of my clients know if we're in my office, I'm probably not wearing shoes anyway. So we're going to be as comfortable as possible to just talk about, what you want to talk about. In terms of questioning, I wouldn't say it's a question and answer thing. I think it's more of a conversation. You want to just be able to freely talk about at your own pace what you want to talk about. I typically will let my clients lead the session. If they want to come in and talk about work or getting their nails done or an appointment they have to make or a time they spent with family and then go into something more serious like 20 minutes into the session, completely okay with me. Everybody is different. I think you just have to remember to do what you're comfortable with. If you want to do small talk first, perfectly fine. Some people come right into the office and get right down into it like, oh my God, this happened. I need you to help me figure this out.
Okay. And why is it so important for people to heal whatever trauma that they've had or been suffering from?
Yeah, I think unhealed trauma, people don't realize that it really does show up in your life in different ways, primarily in relationships. If you have unhealed trauma that's just laying dormant in your body, it will come out in your relationships. You may be a person who has an attachment issue, um, have trouble bonding, have trouble like really opening up to people. And in relationships, that's a big thing. A person want to be with a partner who's open, who can communicate well, who understands other things that they've been going through or things that they're asking them to do. All those things have to do with trauma. So, people with unhealed trauma, they may not be able to communicate as well, or they may not be able to open up as well, or they may not understand if another person, their partner, is going through some level of trauma. If they've kind of blocked it out, they may not be as open to it. And it'll show up in your relationships. It can show up in the work you do as well. When you come to work, if you notice people who are like pretty scatterbrained and, not really organized, late to work, may not dress appropriately, or may not look well groomed, all those things can be unhealed and unprocessed trauma.
Okay. And when it comes to misconceptions, like what are some of the most common misconceptions you hear from your clients and your patients, or even things that you bring up to them and they're like, "Oh, I didn't even know that that was a thing."
Yeah, I think one of the most common misconceptions I see in therapy across the different sectors is inpatient therapy. So, for people who have severe mental illnesses or maybe need to detox from substance use, or having severe suicidal ideations with a plan, and you need to be an inpatient. You need to be admitted inpatient. I think most people think that it's like the movies you have on, straight jackets and white padded walls.
Mhm.
I think that that's the biggest misconception that we see across the board with therapy. Most people don't need a higher level of care to that extent, but if you do, I think people need to understand that it's nothing like that. It's nothing like that. You're not locked in any rooms. The units in these facilities are typically very large, and you're free to roam around the units, freely. They have televisions, they have games, they have music therapy, art therapy. They often have, basketball, tennis courts, things that you can do outside, as well as medication providers that are on staff 24/7, food that's good food. You're not confined to a room. And I think a lot of people are afraid, especially people with more severe mental illnesses, such as like, schizophrenia, or people who are just having paranoia, new onset of mental illnesses. Sometimes they may need to be inpatient for a few days. Or if a person wants to detox, you know, detox typically takes, depending on the drug, 3 to 5 days, sometimes more. And I think that people think that these facilities are like the things you see on TV, and they're really not. Obviously, you can't go and tour them because of HIPAA reasons, but I think that it's something that people should know more about and know that it's nothing like that, to eliminate that fear of having to go there if
Mhm.
it's necessary. Um,
Okay.
Also, with just individual counseling, I think people feel like processing trauma and bringing up trauma will just make them like really sad, really upset, crying a lot. And that's another common misconception. Can it? Absolutely. But typically, after you process your trauma and you get it out, you get to a place where you can heal that trauma, you're in a better space. You feel such a relief. It's such a relief to just be able to just breathe and not worry about being at dinner with a partner one day and some significant trauma just popping up that you forgot completely about.
Okay.
So.
Okay. And so let's say that somebody is looking for help with their issue with it. They either they know they have trauma or they know something's going is wrong, but maybe they can't quite put their finger on it. So let's say they start looking for a therapist or a counselor, and they've never gone through this before. They don't know who to go to. What advice would you give to this person so they can find that professional who they can really trust, that they really can connect with, and you can help them work through their trauma?
Yeah. So they have psychologytoday.com where you can put in your zip code and then you can filter by age, race, gender, specialty, insurance. You can filter out by all those things and find the person in your area that takes your insurance that, fits the profile of what type of therapist you need. And they have therapyforblackgirls.com as well. They have thousands of Facebook groups, Instagram pages, and things like that of therapists as well. In addition to that, your insurance company, if you have insurance, your insurance company, if you call them, they can send you a list of all the therapists that are in network with your insurance. I would recommend going that route first, in addition to something like Psychology Today, because you want to make sure that you're in network and you're not having to pay a significantly additional fee just for therapy when you can find someone that's in network, cover it by your insurance, and you may or may not have a copay for it. There are a lot of insurances who don't have a copay for mental health treatment right now. In addition to that, if they don't have insurance, there are also a lot of therapists who take pro bono cases. There are a lot of counseling facilities who have like counseling interns who have the training or doing that internship phase that I mentioned earlier that will see clients either free or for $20 a session to make it more affordable as well.
Okay. Now, Zena, I'm sure that throughout your experience, you've worked with some pretty maybe challenging cases or memorable cases. Is there maybe one story that comes to mind of just one of those cases you worked on, and ultimately how you were able to help them get a successful result in the end?
Hmm. We'll have a lot of those.
Mhm.
I had a I had a younger teenage client, 14-year-old, who was afraid to come out to their parents. Their parents were very religious, very much so against any LGBTQIA plus anything. And this kid struggled a lot. They started failing in school. They weren't hanging out with their friends. They started using substances. They basically felt like they were in a very bad space because their parents would never accept them as being gay. Uh, so what happened? We did therapy for probably about almost a year before we brought the parents in to sit down and finally open up and tell them, what was going on, why the grades were failing, why they were withdrawing from everyone, isolating, self harming. And the parents pretty much reacted the same way the kid thought they would react. They were not happy. They were not accepting. We spent maybe another 4 to 5 sessions with the parents, just trying to figure out ways that they could support them. But the parents, they just were not open to it. Finally, I got to a point when I, sat down with the parents without the kid and I said, I understand that this is not something that you agree with, something that you would accept, but I do want you to be open to it. It's better to have a gay child than a dead child, right?
Mhm.
And sometimes it is that serious because we have had clients who have committed suicide because their parents wouldn't accept them for who they were. It's a
Mhm.
very real thing. It happens all the time. I see it a lot. This particular client had an attempt. It was not successful, thank God. But, you know, sometimes it is that serious. And this was a very hard case because the family were brought up religious, their parents were religious, and, you know, it was something that they were not open to. So after we had that long conversation, and I'm like, hey, here are some cases, do some research. Google is free about how some of these kids take their lives because they're not accepted by their parents. I said it's okay for you not to agree with it. It's okay for you to not engage in this yourself, but you do have an obligation to your child. And if this is something that you cannot or will not deal with, I'd rather for you let that child live with a close family member who they were close to, who was open to it, to
Mhm.
allow the child to be able to really come into their best self. It's very hard to live a life where you have to hide everything about what makes you who you are and what makes you happy. So after we had that conversation, I gave the parents some homework, some to do some research, and they did the research. They came back and they were like, "I think you're right." It's not something that we like, but we do have to understand that the world is changing. And I say, yes, it's changing. And being gay is not new. It's been around since, Shakespeare, right? It's been around forever. It's just now people are able to be themselves and they're not hiding it. It's different, but there's nothing wrong with it. It doesn't change anything. It's still your child. Your child still has the same abilities that they had before you realize this. They're still great at music. They're still great at art. They still love you. They still want to do all the things that you want them to do, but you need to accept them for who they are.
Mhm.
So this is one example.
No, that's a
That
very,
that was
very
pretty
intense story. Yeah, very intense story. But I can only imagine how many other people are out there who don't bring this up and they don't go to therapy or try and get it solved. So now, Zena, where do you think the future of mental health is going?
It's always changing. I know I've been doing this since about 2014, and I will say that I've seen a lot of changes. I will say right now, the biggest thing that we're dealing with that people may not be aware of is AI. AI is changing mental health in ways that we did not see coming. We've had clients who have been suicidal because of their relationships with their AI companions.
Mm.
You know, um, Very recently, within the last 3 or 4 months, we had a client who was suicidal because their AI companion ended up the relationship ended. Basically, it was a very unhealthy relationship. The relationship ended, and that person could not get through that.
Mm.
So I think that with COVID, with people starting to isolate themselves like they did during COVID, that opened up a window for people to just stay indoors more and more and more. And it hasn't completely went away. Yes, COVID is still around. We're not isolated and locked in like we were, but there are a lot of people who went through COVID who are not coming out and they're isolating, and their companions are AI, you know. So we have a lot of people now who are coming in that have these addictions to AI, these
Mhm.
relationships with AI, which is unrealistic. So we're navigating how to deal with this new group of clients that are coming in with these relationships with AI right now. That was something that I absolutely would have never seen coming in 2014,
Mhm.
2020 even,
Mhm.
but it's something that we're seeing a lot of right now that we're learning to navigate. There are some articles and research and things being done on the relationships between AI and your mental health. Still in the very early stages, obviously, but I think that this is going to be a bigger issue.
Okay. Well, something I would definitely have to keep an eye out for.
Yeah.
Well, Zena, I do have one last question for you, but before I ask it, I do want to point people to your website at chasingthevision.com. Now,
Yes.
last question for you. What does beauty mean to you?
Beauty means to me being able to feel good in your skin. And what that means is just being comfortable with who you are, not caring about what other people think of you, not caring about what society says should be right or wrong, not caring about the state of the world in a sense of just, I'm me. I'm comfortable being me. I like who I am. I like who's looking back at me in the mirror. And I feel good about the decisions that I'm making.
Very well said. Well, there you have it, Zena sharing your expertise. So, Zena, where can people contact you and your practice?
My website, again, www.chasingthevision.com. Instagram I use pretty frequently. My Instagram page is at therapyt underscore. So that's therapy, THERAPYTEA underscore. I get a lot of DMs. I'm pretty interactive on there. I don't post as much as I used to, but I always respond to messages. I do post times where people can ask questions. I do lives. Yeah, those are the best ways to reach me.
Okay. Well, Zena, thank you for coming on, and thank you for sharing your message.
Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.